Hey, good morning, everyone. Dr. Kainkaryam here from 4 Elements Direct Primary Care and Wellness Space, talking to you this morning about how to pay for high-cost care. So many of you might have been seeing in a lot of the news articles and things about the insurance premiums going up for next year. And I've had a lot of people who are asking me, well, hey, doc, how do we pay for high-cost care? So number one, I think there's sort of three different buckets that I tell people that care is bundled into, right? So number one, you've got your primary care. And typically, if you've got a good primary care doctor, they can manage up to 90% of conditions under the primary care scope. The second bucket is sort of your big badness, right? So these are your hospitalizations, your surgeries, and all that other stuff. And then bucket number three are things like physical therapy, occupational therapy. Oh, you got some people who are joining. Good morning, Monica. Good morning, Mo. So that's your bucket number three, right? So these are your other services that are not primary care and that are not hospital care. So what do we do about paying for high cost expenses? So I tell people there's typically four things that people choose to do. So number one is they keep some type of traditional insurance, but especially if they come to our practice, they usually keep a high deductible plan, right? So high deductible plan does a few different things. Number, it allows them to put money away in an HSA if they have it. But number two, it allows them to keep the monthly premium a lot lower. So what this will do is it'll allow you to save more money that you would normally just be paying into a premium. So that's bucket number one, keeping some type of insurance for that big bad day. Number two is, well, there's some people who just live paycheck to paycheck, can't afford anything else. And so they basically say, you know what, I'm going to hedge my bets and I hope for the best. Bucket number three are people who say, well, you know what, if I'm self-employed and I've got a family, say 4, they're typically paying $28,000 a year alone on health insurance premiums, right? So this does not include the fact that they've got maybe an additional $7,000 toward their deductible before insurance begins to even pay anything. So in that bucket, there's some people who will then say, you know what, I'm going to take that 28 plus $30,000 and put it into a rainy day fund. And that's what I'm going to use if we have some really big badness. So that's going to be, and then we'll pull that out from there. The fourth bucket, it does something called use of medical cost sharing. So medical cost sharing is gaining more and more popularity across the United States, especially we're seeing a lot more in Connecticut. I have a lot of patients who've gone to medical cost sharing. And these are what we call benevolent funds. And so the origins of medical cost sharing come from the Mennonite community who do not believe in traditional insurance models. So the whole community pitches in money, pools it toward a particular sort of a pool, and then if someone has a need, if they have a hospitalization, if they've got really expensive treatment, that comes out of that community bucket. However, what's really interesting is that because this is considered cash pay and not insurance, it allows you to get the same care at a lot cheaper. So you don't actually get the insurance rates, you get the cash pay rates. So medical cost sharing is that fourth bucket that a lot of people do. Typically the contributions are about 1/3 the cost of traditional health insurance. And that paired with a direct primary care practice where we try to help give you great care at lower costs for all the other things can really be beneficial. So to answer your question, as people are looking at open enrollment this season, as a lot of people have been asking me about how our practice works and how it works with or without insurance, this is really the way I tell people to think about health in general in three buckets. Your primary care, which really should be trying to manage as much of your care as possible. Then your big badness care, which is hospitalization, surgeries, all the high stuff. And then your third bucket, which are your specialists, your therapies and all that stuff. And then when we talk about paying for that big badness in the middle, there's 4 buckets to summarize. Number one are patients who keep some type of traditional insurance, but a high deductible, low premium. Number two, patients who just can't keep anything. And many states like Connecticut do not have an insurance mandate. So if you do not have insurance, you're not penalized in Connecticut, but you are in Massachusetts. But for many people, the penalty is still cheaper than buying the insurance. So that's a whole other conversation. I won't get in there. Number three are people who say, I'm going to take that same money, put it into a fund or some type of option to, pull out when I need to. And the fourth bucket are people who do medical cost sharing. So drop your questions below if you have it later. I'll be taking a look. And if anyone wants any contact info or learn more about any of these programs, check it out. All right.